Hey everyone, so this is the case study help video for OT066 and the CPT coding book, 5th edition, and it is for chapter 7, and you were assigned the odd case studies. So let's get started. So a little crooked there. Case 1, Chapter 7, Case 1, Preoperative diagnosis of a mass on the larynx, pending pathology report. The procedure that was done is a laryngoscopy. Patient was prepped and draped in the usual fashion, placed in the supine position. 90 degrees, donut headrest, stabilization, mirrors placed for indirect visualization. Laryngoscope inserted. Okay, so to look up, so the laryngoscope was used to visualize, and then, so you're going to look up larynx. That is the weirdest looking X ever up there. But it's an X nonetheless, kind of. There, that looks a little better. Now it just kind of looks like it's an asterisk. And then look up biopsy. So we'll start with larynx and then biopsy. Okay, and so when you're looking that up, make sure you pay attention to the fact that the laryngoscope was used to visualize larynx. Okay, for number 3, case 3, let me flip this down here a little. 32-year-old female brought to emergency department by her sister with right side chest pain. Patient states some suspicious area left base. Okay, so for this one, we are going to look up and percutaneous needle biopsy, okay, of the lung. Okay, so you're going to look up biopsy, and then lung, and then needle. So that's how you'll go about finding the solution for case 3. Okay, hang on, let me flip the page, I'll be right back. Okay, so for case 5, bronchoscope, endobronchial biopsy of small mass was noted. Washings and brushings were taken. Sample sent to histology. Okay, so for case 5, let's start with bronchoscopy and then biopsy from the index. So start in the index with bronchoscopy and then biopsy. Now here's the thing with this one, you will have one code, so let me put notes over here. So you'll have a code for a biopsy of single or multiple sites. And then you're going to need another code for the brushing. So you'll need that too. So just kind of keep that in mind with case 5. Okay, let me pause you so I can flip the book again. Okay, and here we are with case 7, an endoscopy report to rule, the pre-procedure diagnosis is to rule out malignant lesions of the right upper lobe of the bronchus. That's not good. Biopsy, bronchus, okay, so this one's pretty easy. We just look in the index for bronchoscopy. And then biopsy. And then you want to always go back and make sure that you are referencing the code range that is in the main section of the CPT manual. So even though it may show up with a code, you want to go back and make sure that it's the actual right code by verifying back in your the main section of the manual. Okay? And then let me flip again. And then lastly, you have case 9. Which is an ambulatory surgery center report. 34-year-old male patient, an accident 5 years ago. At the time, he had a permanent tracheostomy due to the extent of the injury. Now presents with scar tissue in the area of the tracheostomy. Okay, so the procedure was to repair of the tracheostoma, and you guys know that stoma is the opening. So that's kind of how we'll look that up. So trachea will be what you look for in the index, and then repair. And then stoma. And then you want to make sure that you are selecting the right code. Reanastomosed and closed and sutured layers. Blood loss was minimal. The patient was sent to recovery. Okay, so it doesn't say anything about a flap rotation, which sometimes happens when they do these repairs. So I would just make note somewhere in here that there's no flap rotation. And I don't know that this is the case because I haven't actually looked this up, but if there is a code for this procedure with flap rotation and one without, you want to choose the one without. Okay? And that's it. So that's all for the case studies for Chapter 7. If you have questions, let me know, or hop on the conference on Wednesday evenings for class, and we can walk through them then. Thanks, guys.